The renal dialysis unit at the Korlr-Bu Teaching Hospital is once again facing crisis as it accumulates 2 million cedis debt just 3 months after government settled the debt of 4 million cedis. The unit was forced to shut down last year, sparking public outcry as dialysis patients faced an uncertain end to their lives. But Chief Executive of the hospital, Dr. Pokuwari, says Parliament's delay in approving new fees and charges is putting the renal unit in a very precarious situation. There's more in the following report by Prince Kodoga.
Very common emotions last year as the renal unit of the Korlr-Bu Teaching Hospital was shut down due to an accumulation of debt in excess of 4 million Ghana cedis.
We are now engaged with government, with the ministry, with other stakeholders to see how quickly we can find the resources to advance, because at the moment we are sitting in a 4 million cedi hole. If we are to operate at our current capacity, which is about 2,000 dialysis sessions every month, then it means that we are going to accumulate about 961,000 cedis of debt every month, in addition to the 4 million cedis that we have already. So this is financially unsustainable.
The hospital was forced to reverse an increment in its dialysis charges imposed last year without recourse to Parliament. The patients said the high cost of treatment makes it difficult for them to follow the prescribed sessions.
You are becoming a burden to the society. You pick a phone, you want to call your friend. He knows you are coming to ask for money, so you will not even pick.
Wow.
You pick a phone, maybe you want to even to say hello. Maybe there's an information you are trying to ask him. He will not even answer it. Later on, he will call back and say, oh, I saw your call. Now, this Samuel. It's not true. Because he knew you are coming to ask money. And it's true. When you call the person, it's money.
These prompted series of conversations, including Joy News' thought leadership event on the matter, where the presidential advisor on health promised the debt will be cleared.
We are waiting for what they are supposed to bring and then to be worked on as quickly as possible. The money is supposed to be provided by what? Ministry of Finance, isn't it?
Yes. Okay.
So Dr. Mpoma has to put everything that he's doing, that is being asked to do, as quickly as possible in place. If I were him, I would use 24 hours to put everything in place and present it. Yeah, so they'll present it.
You've already presented.
And
no, you're free to talk, because this is direct.
I've told him what to do.
Yeah.
And then quickly, I'm sure I know what normally such things are very.
Joining us now for more on this is Director of Medical Affairs at the Korlr-Bu Teaching Hospital, Dr. Owusu Sechere. Also joining me is Bafo Kojahenkra, who is President of the Renal Patients Association of Ghana. Let me start with you, Bafo. What's the state of affairs at the renal unit right now?
Thank you very much. Currently, the unit is open to the OPD. We are having our normal sessions. And then the price they asked us to pay, the 380, that is what we are paying. So far, so good.
Let me ask you, Dr. Owusu Sechere, why has there been a delay in approving the fees? Do you know?
I will tell you. I think we have done what we need to do. We send it to Parliament. And it is Parliament that will have to look at the pros and cons and come out with the approval or otherwise. So it will be very difficult, maybe presumptuous, even for me to try to hazard a guess as to why it hasn't gone through.
So how did you accumulate this 2 million cedi debt?
Well, I think the issue of dialysis funding has been discussed. I think I had snippets of the state that you played. Basically, there is an under-recovery. After the time we started the discussion, and then we even closed down and then reopened, there was a debt of 4 million, which thankfully government has cleared. But every additional dialysis session that we make now, we accumulate another debt, because the cost of providing that service is over 750 cedis, and the charge is 380. So there is a 50% or even more cost that is accumulating. So you only need to multiply the number of dialysis sessions we've had since we opened, And even when we were doing the emergency ones to now, and then it won't be too difficult to understand why we have 2 million deaths accumulated and still counting, because on a daily basis we are accumulating, we are still doing dialysis.
Do we risk another shutdown if the approval doesn't come in early, as this debt also starts accumulating?
Yeah, I think the shutdown was occasioned by our debtors refusing to supply us consumables. At the moment, we have a bit of it running, but with the debt accumulating, if we don't get that one resolved, it's only a matter of time, and we probably will run into another crisis.
Dr. Osusecho, I'm grateful for your time. He's Director for Medical Affairs at the Korlr-Bu Teaching Hospital. We're also joined by Bafo Kojo-Ahenkra, who is President of the Renal Patients Association. We'll be monitoring how this unfolds, because we do not want the dialysis center to be shut down again. Let's take a break.